So how we do this, in case you've not done this before, is I just have any of you pick a category and a number. And so what we have as far as categories, you can see them: skin to skin, just skin, meds, just breathe, postpartum dangers, newborn nutrition, preterm, and then neonatal abstinence syndrome and sweet mama. Okay. So anywhere. Let's begin.
Let's do Sweet Mama for 100.
Okay. So you probably know what this is. All right. Type 2 diabetic with persistent hyperglycemia has a macrosomic newborn that must be monitored closely by the nurse during the early postpartum period for two possible outcomes.
Would that be
Is
a post?
we're not talking about injuries, we're talking about something else. Two other things.
Would it be a post-term? The early postpartum period for two.
I would say one of them would be for hypoglycemia.
Okay. Hypoglycemia is one. What is hypoglycemia and?
Respiratory distress.
Good. What is respiratory distress and hypoglycemia? Very good. I need to shrink my screen a little bit, don't I? Pull it up here a bit. Okay. All right. Next.
Meds for 100.
Meds for 100. A natural fatty acid and endogenous substance used to ripen the cervix prior to labor induction, also administered at higher doses during the postpartum period for hemorrhage control.
What is prostaglandin?
Good. What is a prostaglandin? Excellent. Okay, next.
Let's do NAS for 100.
What are the two meds they can breastfeed on?
What are the two meds that are what?
They can breastfeed on when taken.
Okay. Yes. Okay. What two drugs are safe during the antepartum and postpartum breastfeeding and are prescribed for medically assisted treatment programs for substance abuse disorders? Yes. Good.
Skin to skin for 100.
Virginia Apgar. This one's a little trickier.
Mm.
You don't have to know this. What is the name of the author who penned the APGAR acronym? She was actually a physician. You don't have to know that. I just had to fill up another space.
Skin to skin for 300.
300.
Yeah, skin to skin. Yeah.
Newborn heat loss caused by a drafty environment.
What is not convection, is it? What
You
is
have to
not what
tell
is
me.
convection heat loss?
Yes.
Yeah.
What
Mhm.
is convection? Yes. Good.
Just skin for 100.
A pink patch at the base of the posterior neck of a newborn.
Nevis, what is Nevis? Nevis, I don't know the part of it. It's a Nevis something. It's like the stork bag.
Yeah. What is a nevus simplex or stork bite look like? Uh-huh. Good.
Postpartum dangerous for 200.
The nurse is concerned about a laboring patient who is complaining of dyspnea. She is diaphoretic and tachycardic, and her blood pressure is now 90/58.
The signs of what is shock?
Good. What is cardiac failure or shock? Yes. Cardiac failure.
Postpartum dangers for 100.
What is hemorrhage?
What are signs of postpartum hemorrhage? Good.
Just breathe for 100.
Respiratory distress.
What is apnea? Yeah. Respiratory distress, certainly. That's apnea. So we need to do something about it. Do you remember what amount or what time frame, how much apnea is acceptable in a newborn?
20 seconds or less.
20 seconds or
20,
less.
yeah, yeah.
Go, Kaylin.
Newborn nutrition for 200. What are the normal signs of breastfeeding?
So what effective
Oh, latching, yeah, effective.
breastfeeding or proper latching?
Mhm.
Okay, what are the signs of proper latching? Yes. So audible swallowing, no dimpling of the cheeks, and her nipples are not sore. So the baby is latching properly. Okay.
Skin to skin 200.
Signs of evaporation, is it?
Yeah, what is evaporation? Yeah.
Just skin 200.
What is acrocyanosis?
Yeah. What is it? What is acrocyanosis? What does it indicate?
It's a normal finding, but the limbs are blue, the hands and feet.
It's normal. It's just poor perfusion, right? It's just immature, just poor perfusion of the hands and the feet. Okay, good.
Postpartum danger for 400. What is it?
Psychosis.
Psychosis, yeah.
Yeah, that is bizarre behavior, isn't it? It's dangerous to her and her newborn. We certainly want to intervene in that situation. So that's totally different from the blues and just from depression. So she's mumbling unintelligible words. That is a sign of psychosis.
Meds for 200.
Go ahead. Yeah, help stop, intrusion.
What is terbutaline?
Good. So it can cause tachycardia and contraindicated to anybody with any kind of heart disease, high blood pressure. So as a nurse, if we do give this, what are some things we need to do?
Check blood pressure first.
Yeah, we're going to check the blood pressure, and then as we give it, we're going to monitor any problems, just like you would with any new medication. You're going to watch her vital signs after you give it. Okay?
Meds for 300.
What is heparin?
Yes. What is heparin? What is the drug sometimes the patient will go discharged with when they go home?
Warfarin.
Warfarin, maybe even a Lovenox or something. Good.
Skin to skin 400.
Would be what is the normal breathing pattern or
Okay, this might be a little harder for you to find a question about. So, one of the benefits of skin to skin is what is cardiopulmonary stability. So that is just one of the benefits of providing skin to skin. We see the baby's heart rate become regular, a biological stability, and respiratory rate become more unlabored and biologically stable. Okay.
postpartum dangers for 300.
Okay.
HELP syndrome.
Read it again now. Don't go too
Okay.
fast.
What is jaundice?
Oh no, that's what is
So that's
preeclampsia. Preeclampsia.
So normal destruction of red blood cells, hemolysis, often occurs more often in the neonate because they have more red blood cells. Might lead to a high level of circulating unconjugated bilirubin and
Oh,
be evidenced by in the sclera and the face. What is jaundice?
okay.
Okay, so who answered that? Somebody answered that.
I did.
Yeah, yeah. So Carrie, make sure you don't read too quickly. Okay, read the
Yes.
question carefully. All right.
Yes.
Skin to
Newborn.
skin 5.
Okay. Skin to skin.
Yes.
What is bonding?
Yeah. What is bonding? So that's another benefit of skin to skin.
Skin to skin, 600.
And then what's another one we haven't talked about?
Respiratory. What is respiratory?
Thermoregulation.
Thermostability. Yeah, thermostability, heat. So there's cardiopulmonary stability, thermostability, bonding, and then the opportunity for breastfeeding, right? Okay. All right.
Yes, skin free. What are Mongolian spots?
Yeah. What are Mongolian spots?
Postpartum dangers for 500. What is preeclampsia?
Help.
Yeah. What else could it be?
Oh,
Help.
eclampsia.
No.
Oh, gestational hypertension.
Help.
Help. Help
Okay.
syndrome. Why do we say help?
The right upper
Because-
quadrant pain.
The right upper quadrant pain is an indication of
Uh,
HELP syndrome.
And the blood
Yes.
pressure, right, Professor Zeller, is way out of the
Yes.
blood pressure.
Yeah, could very well be because of HELP syndrome. Yes. That's pretty high. So not only we need to address the blood pressure. Definitely, we need to get someone before she'll have a stroke. So what other findings would you see laboratory wise in HELP syndrome?
Elevated
hemo-
AST.
uh,
Elevated liver enzymes and what else?
Oh, the platelets, right?
Yeah, yeah. So thrombocytopenia, low platelets. Good. Yeah.
newborn nutrition one. What is colostrum?
Yes. Liquid gold. Remember, it's also a laxative with high protein content, so it helps that unconjugated bilirubin to conjugate with the protein, and then it can be released, and it helps lower bilirubin levels.
Postpartum dangers for 600.
Is that
So what could be going on here?
She's hemorrhaging, right?
Is that the amniotic fluid embolism?
Yeah, it
What is
could be an
amniotic?
amniotic fluid embolism. What else could it be?
Well, she's hemorrhaging, right?
What makes you think she's hemorrhaging? What cue in there tells you she's hemorrhaging?
Well, they said that she has, well, you're going to apply 100% of non-rebreather. She's clammy. So her body's going through some type of loss of shock or something. Her body's trying to compensate, I would say.
What does it say in here?
Her
She
skin is
delivered her
clammy.
placenta. What does it say? She delivered her placenta, right? What else does it say?
She suddenly gasps and can't breathe.
Okay. What does that tell you? She can't breathe. Other than an amniotic fluid embolus, what other kind of
A pulmonary
possible-
embolism.
a pulmonary embolus? Yeah, so she can't breathe all of a sudden. Something is blocking the pulmonary artery. Okay. Her skin is clammy. Okay. Doesn't say anything about bleeding in this scenario, right? She just delivered, or she is delivering the placenta. So she puts an oxygen mask on her and calls for help. Was a pulmonary embolus or amniotic fluid embolus is okay too. Okay.
Med 4.
I had to do this.
What is Metrogen?
The M1.
Metrogen.
Yeah. Metrogen, yes. Metrogen or methylergonavine. Methylergonavine. Yeah, it's usually given right after oxytocin, very commonly given for postpartum hemorrhage. Yeah.
Meds 500.
ITP, the immune system shortens the lifespan of platelets. And this can be an autoimmune disease. And sometimes it can be a chronic, or it can acutely during pregnancy become worse and cause platelet levels to drop below 100,000. So the normal platelet level is 150,000 at the low end, okay? So sometimes we treat it. We need to treat it during the postpartum. I mean, during right before labor. So what?
What is
So,
corticosteroid?
yes, what are corticosteroids or prednisone? Low dose of an oral prednisone during pregnancy. But if it's early labor, we might give platelets or wait until postpartum to give the platelets. Okay, instead of a steroid. A steroid is going to cause premature closure of the ductus arteriosus. We don't want that to occur until after delivery. So we usually treat it during the pregnancy if we have to, if those platelets drop below 100,000 during the pregnancy, we might give her maybe a 10 milligram dose of steroid. But the later in her pregnancy goes, if she gets to 34 weeks, we don't want to do that. We'll wait and give her platelets if we have to.
Preterm for 100.
Okay.
What is retinopathy?
Perfect. What is retinopathy? The destruction of those very fragile blood vessels of the retina. Because of oxygen, we absorb oxygen through our eyes. The tissues can actually absorb oxygen. Our skin can absorb oxygen, actually, but our eyes are very sensitive to it.
Just in 4.
What is lanugo?
Yep. Lanugo, fuzzy, fuzzy, fuzzy.
Just skin for 500.
What is
What
Vernix?
is
Vernix. Preciosa.
Question 6?
Which newborn would you find this kind of a texture on?
Post-term.
Is that everything?
Yeah, post-term. It looks like parchment is a kind of paper. We often use it when we do baking cakes and stuff. It keeps the cake from sticking to the pan. And that's what sometimes if it's a post-term, a newborn born after the 42nd week, their skin is actually, ready our skin normally, what do you call it, peels off. We don't see it, it just flakes off. So a newborn, it's doing that, which is a normal process if it's post-term. Okay,
Meds for 600.
okay.
What is vitamin K?
Vitamin K.
Just breathe 2.
What is
Respiratory
respiratory
distress.
distress?
What are some other signs of respiratory distress?
Nasal flaring, seesaw
Grunting.
respiration, intercostal
Chest
muscle.
retractions. Cyanosis
Yeah.
of the lips.
Right. Good.
NOS for 300.
What
NAS.
is withdrawal?
Yeah, what are the signs of drug withdrawal? Yes. These babies have no internal regulation.
Just breathe 300. Is it poor perfusion or inadequate perfusion?
Mhm.
What is atelectasis?
Atelectasis, yes, atelectasis. What is atelectasis? When the alveoli collapse.
Just breathe 4. What is positive pressure ventilation?
Yeah, positive pressure ventilation. We're helping the baby's alveoli to expand, open up the airway, and we're holding it a little bit at the end of expiration, very gently.
500, just breathe. What is dexamethasone?
Yeah, we do give it. What is insufficient surfactant? Okay. So if we give the betamethasone prior to 34 weeks, between 24 and 34 weeks, that helps speed up the production of the surfactant.
Newborn nutrition for 300. What would be the benefits of breastfeeding? I don't know how to. Breast milk. There's two major advantages: immunoglobulins and health infections.
What is the other advantage? Other than that, the other advantage that helps digestion. I should say components. Breast milk has two major components. Immunoglobulins that help ward off infections, and the other component that helps aid digestion. What's the other component in breast milk that helps with digestion?
Protein?
Mm.
It helps digest fats and proteins. The pancreatic enzymes, digestive enzymes. Okay. All right.
Just grade 6.
What'd you say?
Just grade 6.
Oh, that's right. Got one left over there.
What is 30 to 60?
I think I spelled that wrong. Tachypnea. I think it should be. That's right. What is tachypnea? What is bradypnea? And what is 30 to 60 breaths per minute? Okay. So trying to get you to recognize the normals and the abnormals. Probably wasn't very good. Sorry.
Newborn nutrition 4.
This one you have to think about for a minute. The benefit of breastfeeding is early establishment of newborn intestinal microflora or beneficial bacteria in the newborn gut. So what does the bacteria in the gut do to aid in newborn homeostasis? I'll just
It
tell you,
helps.
what is vitamin K? Okay, so it's the newborn gut. Once the bacteria is there, that bacteria will produce vitamin K. But for that first week, there's not enough bacteria in that gut to produce vitamin K. So we're going to give vitamin K. So that way the baby's not going to bleed. Okay, but it takes about a week for there to be enough bacteria. You and I, as adults, or even children beyond a newborn, are able to produce our own vitamin K, but not newborns. Okay.
Return 600.
200?
For ages. Oh, you found the time that's really back at one. Oh, he's like, that's a really long time.
I muted you. I didn't know what had noise in the background. So what do we use the fontanelles to assess?
Is that for like ICP or dehydration?
Yeah. What is intracranial pressure and what is hydration status? Yes. So we can assess the fontanelles.
Sweet Mama 200.
Now he is jittery and fussy, not how.
What is hypoglycemia? Or no?
Mhm.
Yeah. Okay. I thought that
What
they
are
wouldn't
signs?
be, sorry, I thought that they wouldn't be jittery. They would kind of be more weak or have more weakness.
Well, yeah, they're weak, but they're going to be jittery, shaky.
Okay.
Those are signs of hypoglycemia. Even 2 hours after breastfeeding. So we're feeding these babies every hour to 2 hours. 3 hours is stretching it, but that might be acceptable too. Okay.
Newborn nutrition for 500.
This cow's milk?
Yeah. Cow's milk doesn't have the right nutrients, and they might not be able to digest cow's milk. They need formula, a commercial formula on the market. Go to the grocery store or to a pharmacy and buy formula.
NOS 200. It's the abstinence scoring. I just don't remember like the full name of it.
Well, this is a model used. How we plan care. Let's see, let me read it again. A model used by NICU. So this is the Eat, Sleep, and Console model. There's another question about what you're talking about. So let's go to 400. It might be here. So this might be what you're talking about. The assessment tool utilized by specialized nurses and providers to determine the need for pharmacological intervention for newborns with withdrawal behaviors. And do you know what we call that?
The neonate abstinence scoring or syndrome
Yeah.
scoring.
Yeah, it's there's a tool, the Finnegan scoring system. It's called the Finnegan scoring system. That's one. Okay. It's just checking reflex rigidity, crying, things like that.
Preterm 300.
Okay. So remember, there's the frontal air bones, okay, parietal bones, and then the occipital bone.
What is I don't know how to pronounce it. The caput succedaneum. Succedaneum.
So this is localized, okay?
What is cephalhematoma?
Oh,
The cephalohematoma. So remember the caput succedaneum is covering the whole, all the parietal and maybe some of the frontal. It's covering all, going over all the suture lines, the fibrous tissues, covering it all. It's just fluids. A hematoma is localized over just one bone, like the parietal bone, or maybe just the frontal, or maybe one on each side, because it's a collection of blood.
okay. I didn't focus on the localized area part. I just saw the edematous area and I just I said the caput one.
Yeah, and that's why it's really important to slow down and read the question. Yeah, yeah. So cephalohematoma. So what would you expect as the outcome of a cephalohematoma? Remember what it is. It's lower subsurface, deep, soft tissue, continuous bleed. So you have destruction. When we talk about bleeding, it's destruction of red blood cells, isn't it?
Yeah, hemolysis.
Hemolysis going on. And so you've got bilirubin being released, and their livers can't stay caught up with that unconjugated bilirubin that's circulating through their blood and then it gets in their tissues. So what are you going to see?
Hyperbilirubinemia or jaundice.
Yeah, you're going to see some jaundice in their eyes and their face initially. So a cephalohematoma, you might see some jaundice. So that needs to be monitored.
Newborn nutrition for 600.
Okay. Let's see.
Mothers that should not breastfeed.
I
These
don't
are,
even remember what the question is.
well, it's telling you all these things they shouldn't,
Oh,
they shouldn't breastfeed.
yeah. Except for at the bottom, it says infectious diseases. So what infectious diseases do we not want mothers? What? Yeah. So HIV and untreated active tuberculosis. Those are two infectious diseases or communicable diseases that can be spread to the newborn through breastfeeding. So, but anything else, of course, herpes, we certainly would want if there's an outbreak on the breast. Okay. All right.
NAS 500.
All right. One more neonatal abstinent baby.
Skin to skin. Or
What is
swallowing.
stimulation?
Yeah, reducing, well,
Okay.
skin to skin too. What is reducing environmental stimuli? Yeah, absolutely. Okay.
Preterm 400.
Okay. So what's going on in this scenario that what could be going on here?
She's got poor thermoregulation.
Mm-hmm.
Could she be hypoglycemic?
Okay. Yeah.
I said withdrawing. She has some type of withdrawal symptoms.
What
She's
do you see
uninterested,
that?
lethargic, uninterested in feeding.
So withdrawal. Do you see lethargy in withdrawal symptoms?
No.
No.
What is sepsis?
What'd you say, Julie?
What is sepsis?
Oh, signs of an evolving infection. So you've got hypothermia. You might see temperature instability with an evolving infection, with lethargy, not interested in feeding. Those are signs of an early infection or an evolving infection or early sepsis. Good. And preterm babies will mostly tend to become hypothermic when they're infected. Okay,
Preterm for 500.
all right.
What is mag sulfate?
Yeah, magnesium sulfate. If we have a mom in preterm labor and she's 32 weeks, we certainly going to get her started on some magnesium sulfate to give neuroprotection to the fetus. What else might we give her? The mom for the baby.
Dexamethasone?
Betamethasone, if she's not received any this pregnancy. So we're going to do that for the baby's lungs, and we might also give an antibiotic. So magnesium sulfate initially, good.
Preterm 600.
I got ahead of myself.
What is dexamethasone?
Yeah, there you go. So she's 28 weeks. So as long as she's beyond that 24th week and she has a history of preterm labor, right? So we're going to go ahead and give that in case she does go into labor. All right, sweet mama's last. Which one you want to do?
300.
I want you to read this carefully. I know these are long, but I wanted to give you enough of a background so you could use your own clinical judgment, your ability to get the data, analyze it, and kind of make a judgment of what you think could be going on here.
What is TIC?
That was fast. So, focused assessment on her type 2 diabetic, type 2, okay? High risk, blood pressure cuff, petechiae. So something's going on. Petechiae is a huge sign of liver problems, right? Platelet levels. Petechiae on her abdomen. So she's bleeding. Surgical site. She had a C-section. It's bleeding. Surrounded by purpura, which means bleeding, bluish patches. And her IV site is bleeding. She knows what's going on. The nurse knows what's going on. She calls the provider and she gets another IV site started. Even though it's going to bleed, she needs to get access into that vein. So what's disseminated intravascular coagulation. So remember, something triggers this. And all the coagulation factors, the factors in the blood that help to coagulate the fibrin. There's none left. They've all been used up. And now she's bleeding. And you talked about DIC at med-surg. So it's not particular to OB. So we have to treat this with antibiotics, fluid. We might have to give her some cryoprecipitates, and then also treat her with anticoagulants, which is kind of a trying to balance things out and support her fluid levels, treat her blood loss. Okay, what's next?
400.
So our diabetic mothers, birth injuries, labor difficulties. So
What is
shoulder
clavicle fracture?
dystocia. Pardon?
Clavicle fracture. Or if it's, hold on. If it's not
She's
moving,
not-
then it's the brachial plexus injury.
Okay. There's a difference between the signs of a clavicle fracture and a brachial plexus injury. So a brachial plexus injury is nerve damage. So paralysis, if you damage a nerve, there's a high risk for actual paralysis, no movement. Okay. If you fracture a bone, you might see still some movement because the nerves are working, but limited movement because of the fracture. Okay. So you might see some movement, but plexus injury, you're not going to see any movement. You might see, it depends on which nerve are damaged, but for a newborn, you're not expected to be able to discern which nerves, because you're not a neurologist or you're not an orthopedic surgeon to say, oh, she's damaged the C5 and 6, but 7 is okay. She can move her fingers, So if you're asked about that, if she's not moving her right arm at all or hand, then it's nerve injury. Brachial plexus. Plexus is a group of nerves.
$500.
What is a DBT?
Yeah, so the patient tells her she's having pain. And so the nurse wants to further assess. She has a suspicion already because it's a diabetic patient and they're at risk for everything. Okay. And so she makes sure she collects a little more data to tell the provider. And she tells her to stay in bed. These patients are not to ambulate until we see some signs of resolution. So deep vein thrombosis. So what do we treat these patients with? What medication do they get?
Lovenox, enoxaparin, heparin.
Heparin, yeah, heparin. Got to get them some anticoagulant first. Okay.
What is mastitis?
Yeah. What's mastitis? So mastitis, we want her to continue to keep her both breasts empty as much as possible. She can continue to breastfeed. She'll be treated with antibiotics, warm compresses to help the breast continue to let down and release milk, cold compresses between feedings for comfort. A supporting, nice, snug-fitting bra because that'll help support the breast. All right, you made it. A lot of good information in there. I know I need to edit a couple of them, but so I hope that helped. Thank you all for hanging in there.